Hi, afternoon, everyone. Welcome. It's a doorstop, but I think we are seated down. But we thought, since we are going through this rather critical period, it's useful to for MOH to give a short update to the media on where we are and how we are going forward. This week, I want to first extend some appreciation. This week, we have started on the revised healthcare protocols to cope with the higher number of COVID-19 infection cases that we are seeing every day. And the response so far has been very good and very encouraging. Individuals who have received the health risk warnings, the HRWs, and health risk alerts, the HRAs, they have been diligently coming forward for their PCR testing. Those who are tested as COVID positive, C+, in other words, they have been informing their household members who have in turn self-declared as persons of close contacts and put under home quarantine. So this is a very encouraging display of personal responsibility. So I want to thank everybody for doing that and for also putting up of all the inconveniences so that we can keep each other safe. Let me recap a few key points from last week's press conference before I go further. One, we are on a path of transition to a new normal of living with COVID-19. It is a journey that is uncertain and full of twists and turns. Two, every country that chooses this path to live with COVID will sooner or later have to undergo a major wave of transmission that we are seeing now, with exponential rise in daily cases. This is almost like a rite of passage before humans and the virus achieve a new equilibrium and things stabilizes. Three, in our transition roadmap, which has 4 stages, we had hoped that this transmission wave can come later, maybe at transition stage B, but it has presented itself much earlier, largely because Delta is just so much more infectious. But we are going through such a wave in a way different from other countries. Others have unfortunately encountered such waves very early in the pandemic, incurring many casualties. For us, we are going through this only after we have fully vaccinated about 80% of our population. 4, it is therefore critical for us to monitor the number who fall severely ill or succumb to the disease, and to monitor carefully whether our hospitals are going to be overwhelmed. And that will be the key. So where are we now? This is day 26 of the current wave. Daily cases, as we have expected, have been doubling about every week, from 100 to 200, 2 to 400, 400 to 800, and it is now in its 4th doubling cycle. So I think let's be prepared that we are likely to cross the 1,000 mark soon. And it's not unexpected. It is a typical behavior of a transmission wave, which typically peaks between 4 up to 8 weeks or 30, 40, sometimes 50 days. In terms of the patients, they are not doing badly. There are over 8,000 cases detected since the wave began on 23rd of August. The large majority, over 98%, have no symptoms or mild symptoms. 10 ever needed ICU. 10 out of the over 8,000 cases, and 3 succumbed. So the percentage that need ICU hovers between 0.1 to 0.2%. Percentage that succumb is 0.04%. The patients who suffered severe illness are not evenly spread. It depends on age, vaccination status, and whether they have underlying illnesses. There is no doubt that if our population have not come forward and vaccinated ourselves in big numbers, we would have seen numerous deaths by now, and our healthcare system would probably have been overwhelmed already. But we have avoided that thus far because of our very high vaccination coverage. Let me now at this juncture hand the floor to Director of Medical Service Kenneth Mak to explain the numbers that has been collated across all hospitals.
Thank you very much, Minister. I'll start flash the charts that we have. Right, thank you. We have been monitoring very closely our overall infection numbers, the number of infections that occur over a period between the 1st of May to the 16th of September this year in particular. And this would be consistent with the time period when we were dealing predominantly with the Delta variant. We've looked also very closely at those who are seriously ill, those who require ICU care, and unfortunately also those who did not respond to treatment and then passed away from COVID-19 infection. And therefore, we're sharing today these two charts which show the percentage of people infected with COVID-19 who subsequently deteriorate and require either ICU care or who pass away. The first chart looks at the proportion of people who are infected with COVID-19 in the different age groups, and we start off 0 to 12, 13 to 19, and subsequently roughly in 10-year age bands, and the final age category being those above the age of 80. The data is based on, as I mentioned earlier, the cohort of cases detected and reported to be infected within that period, May to September. And as you can see from the chart, two important factors influence your risk of requiring either ICU care or dying from COVID-19 infection. And the first is age. We haven't seen any infected person below the age of 30 needing ICU care or dying from COVID-19 infection. In the unvaccinated individuals between the age of 30 and 39, the base rate of death was 0.17%. And the rate of those who needed ICU care or dying in the joining table was 0.84%. And that means in 1,000 infected persons, there will be at least 8 individuals who are seriously ill that either require ICU care and with that risk of dying. These affected younger people have consistently had chronic medical conditions, which made them more frail, more vulnerable to a more severe infection. The medical conditions that we've found that increase the risk of a severe infection in these younger age groups include diabetes, heart disease, obesity. Pregnant women are at higher risk of getting a severe infection and requiring ICU care. The risk progressively increases with each decade of life, and the highest risk of mortality is in individuals above the age of 80. If you work the math, the relative risk is between 18 to 70 times higher in those above the age of 80 compared to those in the ages between 30 and 39 years. And this explains our clear concern for our seniors. Vaccination data is presented on the right side of each of the tables. And from the data, you can see that vaccination protects. It provides a protective benefit. It lowers the risk of getting severe infection and of dying. In the fully vaccinated people, we only see a risk of needing ICU care or dying rising in seniors above the age of 70 years. In seniors between the ages of 70 and 79, vaccination brings the risk of ICU or care or dying down and comparable to an unvaccinated person who actually is in their 30 to 39 year age group. And when we look at death on its own, vaccination brings that risk of death in seniors above the age of 80 to a level comparable to unvaccinated individuals in the 50 to 59 year age band. So it's a clear protective benefit from vaccination. It is therefore extremely important to undergo vaccination. There's strong evidence now that vaccination protects you from a severe infection and death, not just from international data, but from our own local data. Even if you're partially vaccinated and had not completed that full regime, there's some protective benefit. Your risk of needing ICU care and of dying has decreased because of that partial vaccination. We see deaths in this category only in seniors above the age of 80, compared to unvaccinated groups where deaths in younger age groups has occurred. So even if you have previously hesitated and not registered for vaccination earlier, it is still a good idea to come forward to get vaccinated now, even while the incidence of COVID-19 cases in the community continue to rise. I should point out that the death among the numbers of people who are detected to be infected in the last week would be underestimated, because it takes some time for a person to get infected and subsequently to require ICU care or death as you deteriorate. And that clinical deterioration tends to occur after the first week. Death therefore lags the onset of the infection by about 7 to 10 days. However, given the trend seen in the cases early in the year, I have no doubt in my mind that a similar pattern will show, and the points I've just made remain valid. So, Minister, back to you.
Thank you, Kenneth. I hope this data is useful for everyone out there. As to what is ahead of us, there are 3 uncertainties that we are currently grappling with. The first is how long more daily cases are going to rise exponentially before the trajectory bends and then eventually turns downwards, because no wave lasts forever. If it doubles for the 4th time, we will see 1,600 cases a day. If it doubles again for the 5th, it will be 3,200 cases a day. That's the first uncertainty. Second uncertainty is whether we will run out of ICU capacity. We are ready to increase capacity of ICU from around 100 now to 300 or close to 300 beds at short notice. It also depends on what percentage of infected cases need ICU. And based on the data that Kenneth presented just now, it is low, between 0.1 to 0.2% overall. And we hope it stays that way, and better still, can be lower over time. Third uncertainty is whether our hospitals as a whole will be overburdened, running out of even normal hospital beds, with nurses and doctors not able to cope with the increased workload. I mentioned earlier that we are ramping up, I mentioned earlier last week, that we are ramping up the capacity of our community care facilities by another 1,000 beds. And this will help divert demand from hospitals, as majority of the patients have no symptoms or mild symptoms. But soon, the CCFs will also be full, which is why we must encourage home recovery. And so far, 597 infected persons have taken up home recovery. And that includes 13 children below 12 years old. Their experiences have been positive so far, and 32 of them have been discharged. We will further expand home recovery as the default care management protocol for more fully vaccinated individuals. We will extend the scheme progressively to individuals aged below 70 years old and who have no significant comorbidities or underlying illnesses. And we hope that in the coming week or so, 70% of all cases can opt for home recovery, and to relieve the pressure on hospitals and then on CCFs. For the past 2 days, 1/3 of our cases go for home recovery. By next week, we hope this can go up steadily to about 70%. And that will make our entire response system so much more resilient, even as cases continue to rise. We will therefore be watching these trends very carefully, trajectory of the daily cases, how they translate into ICU admissions, and then the take-up of home recovery. And these are the critical parameters going forward. The trajectory and the need for ICU is not totally out of our control or externally just imposed on us. They are dependent on our action, and this is part of the human-virus equilibrium that we need to strike. There are things that we can all do to shape the outcome. First, if you are not vaccinated, please go for it. We continue to make progress in whittling down the number of unvaccinated seniors. I remember a couple of months ago, we have 200,000 of them unvaccinated. Today, it is under 87,000. Under 87,000. We are more than half that number. And if it's your turn to get a booster shot to strengthen your protection, please also go for it. Second, all of us need to spontaneously reduce our social interactions and activities. Cut back on social outings with friends and having dinners. Don't bring too many friends home. Avoid hopping from one shopping mall to another. And I see actually many people are already practicing that and doing so. Third, and this is especially important for our seniors and those with underlying chronic illnesses. Avoid and cut down activities so as to reduce your chance of being exposed to the virus. These groups have a higher risk of severe illnesses when infected. And if unvaccinated, the risk is actually quite high. For example, for the unvaccinated seniors, more than 1 in 3 will require oxygen or ICU even if infected by COVID-19. So stay at home if you can and avoid going out unnecessarily. Especially do not congregate in groups. Pull down your mask and chit-chat for a long time. Avoid doing that. Don't do that. Because if someone in the group is infected, you are almost certain to be infected too with the Delta virus. And we see the virus spreading that way when we had the Bukit Merah cluster and also when we have the Chinatown complex cluster. And if you live with a senior or someone with chronic illnesses, please help keep them safe. Advise them to stay at home during this period. Don't socialize so much and inadvertently bring the virus home and infect them. Instead, help them buy things, buy food, buy kopi in the morning, for example. Now, number 4, exercise personal responsibility to self-test and monitor our own health status. We started distributing ARTs, self-test kits, to all residential households from the 28th of August. And by next Monday, about 90% of all households would have received your ART pack. In addition, schools are also distributing ART kits to students and staff. And we are also supporting companies who is also encouraging their employees to go for self-tests. So I encourage everyone to do self-tests. Self-test ART, they are what we call fast and easy test kits. I think using them will be a new habit in this COVID-19 new normal. The ART is not as accurate as PCR, but it can help us quickly pick up a case and prevent the onward transmission of the virus. But what happened when you self-test and you got a positive result? That means an AG+. So let me now invite DMS again to explain what an individual needs to do when tested positive with an ART kit. Kenneth, please.
Thank you, Minister. And as Minister has pointed out, as we see more infections in the community, it's important for us to do more testing in the workplace to allow us to safely participate in more activities in the community and at home. And we've made ART test kits widely available to the public, whether through the community pharmacies and selected supermarkets, through the home deliveries to every household, through the workplace, in cooperation with the employers who have also provided test kits for employees to perform routine regular testing. Today, we're announcing the deployment of 100 vending machines across the island in 56 locations. And these vending machines further provide individuals who have been issued with health risk warnings or health risk alerts with the opportunity to get test kits at any time of the day from tomorrow. If you are symptomatic and have fever, respiratory symptoms, or loss of smell and taste, we continue to strongly encourage you to attend at a SASH clinic where your family doctor may perform a PCR test on you to exclude COVID-19 infection. And while awaiting a test result, we ask that you return home and self-isolate. It is important that you do not continue to work or to further engage in social activities, coming into contact with other people. And this will help to avoid further spread of COVID-19 to other people, particularly your loved ones who may be vulnerable. And even if the test result were negative, but you remain symptomatic, it is likely that you may have other infections which also can easily spread to them, making them sick. So you should still continue to isolate yourself until you recover from your infection. And if you're diagnosed to have COVID-19 infection, we will assess you further to determine whether you can safely recover at home in self-isolation. And this will be the default recovery setting for most people, and we expect that up to 70% of infected people who are relatively well or mildly symptomatic will be able to safely isolate and recover at home. There are others who are unable to safely do so, or those who have risk factors which benefit from closer monitoring. And these individuals may then recover in the community care facilities or CCF or in the hospital. We have published a guide earlier in the week to explain what to do if your PCR test is positive and the options for recovery, particularly at home. But for those of you who are asymptomatic and who have performed an ART test and that test result is positive, please do not continue to go to work or continue your social activities. What is important is that you must isolate yourself from others at this time. And this is the socially responsible thing to do in the event that you're really infected, to protect others from being infected themselves. There is no need to rush to an hospital emergency department to get yourself tested. And where there's any concerns, you may go to one of our SASH clinics where a GP is able to assess you further and decide on the necessity to perform a PCR diagnostic test for you. In fact, if you rush to the hospital A&E department, you may inadvertently expose yourself to more risk because there may be other infected people present in the hospital. So if you have a positive ART test and you are able to self-isolate, we encourage you then to stay at home for at least 72 hours. And that allows you then to safely recover during that period of time, monitoring your own health and not then spreading infection potentially to any other people. At the end of the at the end of that 72 hours, we would encourage you to do another ART test. And if your second ART test is now negative, you can then have the peace of mind knowing that you have recovered from your infection, and then you can progressively resume your normal activities, going back to work and going back to social activities as well. If, on the other hand, you're unwell at any time during this period of self-isolation, please visit your GP as soon as possible so that your GP can reassess you and, if needed, perform a PCR test to clarify your status and your situation. And he will then give you further advice on what to do next. What we want to do through this modified new regime of self-isolation is to give you the empowerment to be able to take charge of your health, and particularly if you're asymptomatic, to allow you to continue as much of your activities in the community as is safely possible without exposing other members in your household, your friends, your colleagues, and other members of the community to any risk of infection. At this time, with the rising number of cases in the community, as the Minister has stated, I encourage you too to minimize your social activities in the community. Work from home as far as is possible. If you have tested positive, self-isolation is the most important measure that you can take to protect your loved ones. And you have not vaccinated yet, please register for vaccination. If you're eligible for a booster dose, please register for your booster vaccination injection. And we can all each do our part to fight against COVID-19. But that first part, that first step, must come from our willingness to do our bit, to test, to isolate ourselves, and to vaccinate. Minister.
Thank you. So even as our infections are still rising rapidly, we can all play our part to determine the trajectory of the infection curve. We are not the first country to have gone through this baptism of fire and will not be the last, but our position is different because we are more than 80% vaccinated. In fact, 85% is now have done their first shot, which eventually means we will have 85% of our population vaccinated. And we are not completely helpless to determine how the situation will unfold. We can all do our part, and with collective effort and will, we can overcome this right through this transmission wave while keeping the number of serious illnesses and deaths as low as possible. We'll now take some of your questions. Thank you.
Thank you, Minister and DMS. We will now begin with the Q&A session. So members of the media, please remember to use the raise hand button if you'd like to ask a question. Please ask one question at a time to allow more to participate in the Q&A. So a reminder on the embargo. The embargo will be at the end of the doorstop interview, and we will announce the embargo. And we will take up to about 5 questions. Can we have the first question from Timothy from ST?
Thank you, Minister and DMS. Now, just now at the start of the press conference, Minister Ong said that cases are doubling as expected every week. But at last week's press conference, actually, Minister, you said that we could expect the number of cases to double every 10 days. The current pace of increase has exceeded that. Yesterday's cases were 4 times that of September 6. Or even if you look at the week before last, if you take your 7-day time period, cases from September 2 to September 9 went from 177 to 419, which is more than double in 1 week. So could we please confirm the expected rate of doubling, and is the situation getting out of control? Thank you.
I think it's still within our expected range. I did say doubling about 10 days. So it's rising faster than we expected. As I mentioned, in fact, we were hoping that such a wave will come much later when we open up further. But Delta is just very infectious. And also it depends on how much we are circulating as people, because the virus don't travel by itself. We bring it around. And so it is now doubling, as we can see, every 7 days. 7 days, 10 days, this is the number that we are coping with. What is important is not 7 or 10 days, but the parameters that I was mentioning just now. It goes back to as it doubles and rises rapidly, what percentage translate into ICU admissions and deaths, and whether we can get our healthcare protocols updated and refreshed in time, moving more people to home recovery, and then we can ride the wave. Yeah. So I recognize the timing is now even more compressed, which is why we are also announcing new measures to step up and increase the number of home recovery. Yeah. Anything further you want to add?
So just to expand on to Minister's comments, indeed we are looking at the total number of cases. It's continuing to rise, and the doubling time is roughly between 7 and 10 days. So Timothy, it's within that same ballpark. What I've been looking very closely is whether or not that same rate of rise translates to a rate of rise in the number of cases that actually are dependent on oxygen therapy or those who require ICU care. That has also slowly risen, but not at the same pace as we're seeing the total number of cases. So they're starting, it seems to be emerging a trend where the total number of cases which rises is not rising in sync or with what is happening as far as the number of cases that require ICU care or oxygen support therapy. This is a trend that we're watching closely to see whether this resembles what has happened in other countries like the UK. And certainly if it continues to follow a very similar pattern, such that we continue to see a higher number of cases occurring in the community, but a disconnect emerging where the total number of cases in our hospitals requiring oxygen therapy or ICU doesn't follow suit at the same rate, we may actually be all right. And the healthcare resources we have would be well able to cope and cater for those who are more severely affected by COVID-19 infection and who require us to spend more time, more attention caring for them. So this is what we're watching very closely. While the indications are encouraging at this point, the data is still very early. And we do need to look at the situation over the next 2 weeks to better understand whether that trend continues. And if it does, if it becomes more starkly apparent that there is that difference in the rate of increase of total cases and the numbers that actually require ICU care, I think this would be a good sign for us.
But what we are quite clear is that you can't sustain many rounds of doubling. Yeah. Even when we have a very small conversion into oxygen supplementation needs or ICU care. So it's not so much whether it's 7 or 10 days that's crucial now, but I think the next 2 weeks is crucial because we will then understand the trajectory. And I think if you listen to our talking points just now, I think it's really time for us to and I think many people are actually doing that already, to adjust our social activities so that we spontaneously know how to adjust and adapt to the virus and achieve an equilibrium, something that society is able to calibrate, to self-test, to get ourselves vaccinated. And these are steps that we take as society in order to reach an equilibrium with the virus. To live with the virus, I think this is an inevitable process that we need to go through.
Okay, thank you, Minister DMS. Can we have the next question from Zipeng from Zaobao? Zipeng.
Good evening, Minister Ong and DMS. By expanding the suitability criteria for home recovery, could this actually potentially result in an increase in community cases, since patients recovering at home could easily pass the infections to their family members, even if they have no household members older than 80 years old? I believe seniors in their 70s are also considered vulnerable. Thank you.
Thank you very much for the question. We've taken pains to craft a framework that provides for safe recovery for those who are able to recover at home, but yet at the same time not pose any increased risk to members of the public in the community or their household members. So it's not just looking at their eligibility criteria to determine whether they're at risk of further deterioration, of needing to get admitted then subsequently into the hospital, into ICU care, but we actually look at the home situation for each of the cases, whether they're able to isolate themselves at home, whether they share communal facilities with others in the household, whether they are forced to use the common kitchen, toilets, and what the risk would be for others in the community. So a careful assessment is done for each of the cases. And it's only when we are assured that all these are met will we then allow that home recovery to take place. That said, we have recognized that we had started very cautiously because we wanted to make sure that this was absolutely safe for both patient as well as for the community. But we've come to realize that, in fact, more people can avail themselves of the home recovery option, and we've progressively, over the last week or two, allowed more people to get onto the home recovery program. However, we have not compromised on our assessments and our assessment that this continues to be that has to be continue to be safe for the community and for the household.
Just to point out, Zipeng, just now you mentioned people above 70. Our rule now, the guideline is home recovery for those below 70 years old. So you're above 70, we will take you to a community care facility. Yeah. I should also just add, and I probably said this last week, that actually in many places around the world, In Japan, Europe, all European countries, UK, US, home recovery is the default actually. But they have a different starting point. They've been dealing with influenza every year, and influenza you recover from home. So their starting point was an influenza protocol. For us, our starting point is a SARS protocol, and the two are now currently converging. So I think what converges will be a majority home recovery, and the rest go to a facility like in the community or in hospitals.
Thank you. Thank you, Mr. DMS. Can we have the next question from Shirley from CNN? Shirley? Sorry.
Okay, so is it my question?
Yeah, Shirley.
Yeah, so I have a question about booster vaccines. Will Singapore ever start mixing vaccines for the boosters, and when might we do that? And if we are possibly looking into other treatments that we might purchase, since the NCID chief actually mentioned earlier that we can't rely on vaccination solely alone.
Thank you very much, Shalene. The expert committee for COVID-19 vaccines has been looking very carefully at various booster vaccination strategies. And one of the strategies included in their review is to mix vaccines to determine whether that provides a more optimal augmentation of the immune response compared to using the same vaccine as the previous doses for their full regime. This is something that we expect will lead to a recommendation coming out from EC19V very soon. And once that comes out, we'll take that on board and we may adjust our strategies accordingly. At this point in time, EC19V has advised us that for the purposes of our booster vaccination strategy, the mRNA vaccines can be treated as equivalent to each other. So that means if you start off having been vaccinated with the Pfizer BioNTech vaccine, you may proceed with your booster vaccine using the same vaccine, or you may actually book an appointment to get your booster dose using the Moderna vaccine. And once those who had previously been vaccinated using the Moderna regime become eligible for boosters, because that program started a little bit later, then similarly they may avail themselves of either mRNA vaccine when they register for their booster dose. The EC19V will be looking at alternative regimes, and as and when other vaccines are available in Singapore, approved by HSA, then they will be incorporated both into our national vaccination program, and we may see then subsequent recommendations about whether they can be used also for booster strategies, but not at this time. Separately, the Ministry of Health is looking at various other treatment options to help to improve outcomes, both for those who have had COVID-19 infection, but also possibly for those who have been exposed to COVID-19, and these medications might be used to reduce their risk of getting a very bad infection subsequently. But many of their reviews have yet to complete, and we're not able to make any firm announcements on this right now. But to show you, we are continuing to look at expanding our armamentarium to treat people who have COVID-19 infections, to give them as best an outcome as is possible.
Just to respond to the comment on made by Professor Liu Yisin, what she said is spot on, and represent also the consensus of many scientists around the world. Vaccination alone wouldn't be able to make us live with COVID-19. You got to have treatment. You got to keep NPIs, non-pharmaceutical interventions intact, especially wearing of masks, reduce density, improve ventilation of rooms. You got to go on a testing strategy, make testing part and parcel of our life now as part of the habit. Combine all these, then there's a possibility, and I believe we can, live with COVID-19 as an almost endemic disease. Take away any portion, any part, any component, and I think we can't be successful. So we have to do all this at the same time, which goes back to our earlier point. We are very well vaccinated, and that has prevented many cases of severe illnesses. Because at this kind of infection rate, if we have not been vaccinated, our hospital would have been overwhelmed already. But because we vaccinated everybody, before we start opening up, we are able to sustain and be able to ride the wave so far. But it wouldn't be enough. From here on, we have to start adjusting our social activities, especially those who are senior in age or has chronic illnesses. Start adjusting, start to practice the NPIs, start to get testing going. Then I think we can coexist with the virus.
Thank you, Minister DMS. Can we have the next question from Elaine Ho from Central News Agency? Elaine, please.
Hi, Minister and DMS. I would just like to follow up with the review process of Sinovac, because it's more than 2 months since the SHA received additional information from Sinovac. Thank you.
Thank you very much. HSA continues to work on completing its review of the Sinovac vaccine. They had previously made some requests for additional information to be contributed from the manufacturers. The manufacturers had given additional information in, but then I understand that there has been some additional requests for more information, and that process of collaboration between the manufacturer and HSA continues. We remain hopeful that once HSA completes its process, we might see HSA coming to a firm decision and giving us a recommendation as to whether or not the PISA approval can be granted then to the Sinovac vaccine. In the meantime, as you may know, we have allowed that vaccine to be made available under the special access route framework, and clinics in Singapore have given vaccinations to individuals using the Sinovac vaccine.
I think the new stock is still slated to arrive around 20th of September, plus minus a bit. And then with stock refreshed, it will be available in the clinics again.
Thank you, Minister DMS. We will take one last question. And this last question will be from Zheng Yi from Channel 8 News.
Hi, Minister and DMS. Will the Trace Together app be updated to show if a person is issued health risk warning so that they do not dine out, for example? And Minister, can we trouble you with a Mandarin soundbite on home recovery becoming the default care model? Thank you.
Trace Together having health risk warning. Do we know?
Not yet. I think that's still under review.
Yeah. Okay, that's under review. I will discuss with the IT team if that is possible. But I think what is more important, and I think it has been very encouraging, which is that individuals who have received health risk warnings, they have been extremely cooperative. It's like well over 90% will go get their tests and get themselves isolated. So I think right now, nothing beats our own personal responsibility. And I think we continue to count on that as we bend the curve and ride through this wave. You wanted a Chinese soundbite on which aspect?
Home recovery.
Home recovery.
As a default.
OK. 居家康复啊。哎，你在考我，我想，随着病例的增加，我们其中一个非常要注意到的问题，就是我们的医院呢，能不能承担这些新的这么多的病例？所以很重要的一点就是，不需要病床的病人呢，尽量不要到医院去，到社区里的设施康复。但社区里的设施啊，我们的这个 community care facilities 也是床位是有限的，再过不久我看也会爆满了，就开始要2-3个人住在同一间房。所以更重要的就是没有症状或者非常轻微症状，尤其是比较年轻的病人呢，能够在家里康复啊，像普通伤风感冒都在家里康复。只要你是已经完全接种了这个疫苗，其实大致上98%以上的病例呢，都是没有症状或者非常轻微的症状，可以在家里康复。所以我们有这个居家康复计划，现在办得不错。前2天呢，1/3的病例啊都在家里康复，一共597个人 而且32个前几天呢都已经康复了，已经出来了。所以我们希望更多人能够在家里康复。我们也展开把这个居家康复计划扩充起来，希望70%的病例可以在家里康复。所以呢，现在这个星期呢，逐渐的就是所有的病例啊，如果是你70岁以下或者没有一些疾病的话，都可以在居家康复。我们的工作人员会适当的处理每一个病例。谢谢。